It's the middle of the night. The house is quiet. Somewhere down the hall, a clock ticks, and the only light comes from a thin gray line under the bedroom curtains. A man in his 70s opens his eyes. He doesn't want to be awake, but his bladder has other plans, the way it does almost every night now, so he does what he has done 1,000 times. He pulls back the blanket, swings both legs over the side of the bed, plants his feet, and stands up. 1 step, 2 steps toward the bathroom, and then the room tilts. It's a strange feeling, like the floor has quietly shifted under him. His vision narrows at the edges, as if someone is slowly closing a curtain. His ears feel full. His knees go soft and uncertain, like they belong to someone else. He reaches out in the dark, fingers searching, and catches the edge of the dresser just in time. He stands there, gripping the wood, heart pounding, waiting for the world to settle back into place. After a few seconds, it does. The dizziness fades. He feels foolish, maybe a little shaken, and he finishes his walk to the bathroom telling himself it was nothing. He may blame his age. He may blame his balance. He may think he simply stood up too fast. And maybe some of that is true. But there is something he probably hasn't considered. The small capsule he takes every day for his prostate, the one that finally helped him pee again, may be part of the reason the room tilted. That doesn't mean the medication is bad. It doesn't mean he should stop it. But it does mean that this moment, that 3-second walk from the bed, deserves a closer look. Because for a lot of men, that's where a serious fall begins. So let me ask you something before we go any further. Have you ever felt the room shift when you stood up to use the bathroom at night? Hold on to that feeling, because in the next few minutes I'm going to explain exactly why it happens and what you can do about it. If this is the kind of clear, practical health information you want more of, take a second to subscribe. This channel turns complicated medication information into clear, practical conversations you can bring to your own healthcare team. That's all we do here, and I'd be glad to have you. Now let's go back to that bedroom, because there's a common misunderstanding I want to clear up right away. The bed is not the problem. The bed didn't make him dizzy. Lying down didn't make him dizzy. What caused that tilting room was the transition, the fast change from lying flat to standing upright. That's the moment everything happens. Here's why. When you're lying down, your blood is spread fairly evenly through your body. Your heart doesn't have to fight gravity very hard to keep blood moving up to your brain. But the second you stand, gravity goes to work. It pulls a wave of blood downward toward your legs and your belly. In a healthy, quick-responding body, this is no problem at all. Special sensors in your blood vessels feel the pressure drop, and within a heartbeat or two, they send a signal. The blood vessels tighten, the heart picks up its pace, and blood is pushed back up to the brain before you ever notice a thing. But if that response is slow or weak or blunted, even for a few seconds, your brain gets a little less blood than it wants. And your brain, which is very particular about its blood supply, responds with exactly the symptoms our friend felt. Lightheadedness, a narrowing of vision, unsteadiness, that feeling of being close to fainting. Doctors have a name for this. They call it orthostatic hypotension. Let me say it slowly, because it sounds more frightening than it is. Orthostatic just means related to standing up. Hypotension just means low blood pressure. Put them together and you have a simple idea. Low blood pressure that shows up when you stand. That's it. A drop in pressure at the exact moment you rise. Now, where does the prostate capsule fit into all of this? To understand that, we need to talk about what the medication actually does, and the answer involves 2 very different doors in your body. The capsule we're talking about is most often sold under the brand name Flomax, but you may know it by its generic name, Tamsulosin. Let me say that one carefully too, Tam-Su-Lo-Sin. It belongs to a family of medicines called alpha blockers, and it's prescribed for one main reason: to improve the urinary trouble that comes with an enlarged prostate, a condition with the long name benign prostatic hyperplasia. As a man ages, the prostate often grows. And because the prostate wraps around the tube that carries urine out of the bladder, that growth can squeeze the tube like a hand around a garden hose. The stream gets weak. Starting becomes hard. The bladder never quite empties. So you're up again 2 hours later. Tamsulosin works by relaxing the smooth muscle around the prostate and the bladder outlet. It loosens that grip. The tube opens up and urine can finally pass more freely. So here's the first door. Think of Tamsulosin as gently loosening a doorway so urine can move through instead of being held back. For a lot of men, that's a real relief. The stream improves. The nighttime trips become fewer, life gets a little easier. But here is the part nobody explains at the pharmacy counter. The very same kind of receptors that the medication relaxes around the prostate also exist in the walls of your blood vessels. That's the second door. And when those receptors relax, blood vessels can loosen too, which can lower the pressure inside them. So a medicine aimed at your urinary plumbing can, in some men, also nudge the system that controls your blood pressure. Now, I want to be fair and accurate here, because this matters. Tamsulosin was actually designed to be more selective. It tries to focus its action around the prostate and bladder and to leave the blood vessels alone as much as possible. That's one of the reasons it's so widely used. And that's also why I am not telling you that everyone who takes it will get dizzy. Many men take it for years and feel perfectly steady, but selective does not mean zero. Dizziness, a drop in blood pressure when you stand, and even fainting can still happen, especially under the right conditions. We'll get to those conditions in a moment. And let me clear up one more thing while we're here, because it confuses a lot of people. Tamsulosin is not a blood pressure medication. Nobody prescribes it to treat high blood pressure. The blood pressure effect is a side effect, not the purpose. And just as importantly, this medication treats the symptoms. It helps you pee. But it does not necessarily shrink the prostate, and it does not cure the underlying condition. It's managing the traffic through the doorway, not rebuilding the house. Let me make all of this real with a story. I want to tell you about a man named Frank. Frank is 76. For about a year before he started the medication, his nights were miserable. He was getting up for sometimes 5 times to use the bathroom. And when he got there, he'd stand and wait for a stream that didn't want to start. He was exhausted. His wife was exhausted because every time he got up, she woke up too. So his doctor started him on Tamsulosin. And honestly, within a few days, it helped. The stream came easier. He wasn't standing at the toilet at 3 in the morning feeling defeated. He was grateful. But something else started happening, something small. When he got out of bed at night, he'd feel a quick wave of dizziness. A few seconds of the room going soft and uncertain. And because it passed so fast, because by the time he reached the bathroom, he felt completely normal. He never mentioned it to anyone, not to his wife, not to his doctor. It just didn't seem worth bringing up. Until one night, he stood up quickly, the way you do when your bladder is insistent and you're half asleep. The dizziness hit harder than usual. He got disoriented in the dark, lost his footing, and went down against the corner of the nightstand. He was lucky. No broken hip, no fracture. But he hit hard, and the sound of it brought his wife straight up out of sleep, frightened. And honestly, it frightened Frank too. Here's what I want you to take from Frank's story, and it's important. The lesson is not that the medication was bad for him. The lesson is not that his doctor made a mistake. The real discovery was that Frank's body, his dose, his other medications, and his nightly routine all needed a second look. Things that quietly had never been reviewed together. And let me be honest about something the audience watching this already knows. A lot of medical appointments are short, 15 minutes, sometimes less. The prescription gets written, the basics get covered, and there often isn't time for the practical question that matters most. At 2 in the morning, how do I actually get out of bed safely? That gap isn't anyone being a villain. It's just the reality of a rushed system. And it's exactly the gap this video is trying to fill. So let's talk about why nighttime, specifically, can become a perfect storm. Because if you wanted to design the riskiest possible moment for a dizzy spell, you would design exactly the situation Frank was in. Think about everything stacked against him. He had been lying down for hours, so his body was fully settled into that flat, resting state, which makes the standing transition more abrupt. He stood up fast, because a full bladder at night doesn't politely wait. The room was dark, so he couldn't see well enough to steady himself. His glasses were on the nightstand, not on his face. There was no cane, no grab bar within reach. His muscles were stiff from sleep, slower to react. He was groggy and half dreaming, and like many men his age, he was already taking other medications, perhaps for blood pressure, perhaps for his heart, that quietly affect the same system. Now pile all of that on top of one another. Urinary urgency, pushing him to move quickly, darkness hiding the obstacles, stiff muscles, and poor balance. And a brief, harmless-seeming drop in blood pressure right in the middle of it. Any one of those alone might be nothing. Together, they can turn a 2-second wobble into a fall. And here is the part I really want to land. For most men, the dizziness itself is not the true danger. The dizziness lasts a few seconds and passes. The real danger is what the dizziness makes you do and what you hit on the way down. It's the corner of the nightstand, the edge of the bathtub, the tile floor, the hard furniture. A fall at 76 is not the same as a fall at 36. A broken hip can change everything about a person's independence. So when we talk about reducing risk, we are really talking about preventing that one bad landing. So let's get specific about when this risk deserves extra attention, because it is not the same every day. There are certain windows when the odds tip higher, and these are worth knowing. The first window is when you start the medication. Those first days and weeks when your body is still adjusting to it tend to be when dizziness is most likely. The second window is after a dose increase. If your prescriber raises the amount, your body is essentially adjusting all over again. The third window is one almost nobody thinks about. After a break, if you stop the medication for several days, maybe you ran out, maybe you were in the hospital, maybe you simply forgot while traveling, and then you started again. That restart can act a little like starting fresh. In fact, the official patient information specifically advises contacting your prescriber before restarting Tamsulosin after you've missed it for several days. I want to repeat that because it's the kind of thing nobody mentions. If you've been off it for a few days, call before you jump back in. There are other situations that raise the stakes too. If a new blood pressure lowering medication has just been added or adjusted, if you're also taking an erectile dysfunction medicine like sildenafil, tadalafil, or vardenafil, which can lower blood pressure on their own, and if you already have a history of low blood pressure, fainting, or balance trouble, you're simply starting from a more sensitive place. Now, please hear me clearly on this. I am not telling you to change your dose. I am not telling you to stop and restart your medication to test what happens. Please, never experiment on yourself that way. What I'm giving you is awareness, so you know which moments to watch more carefully and when a phone call to your prescriber is the right move. And speaking of practical moves, let me give you the single most useful thing in this entire video, a safe way to get out of bed. I want you to learn a simple sequence, and I'll give you a phrase to remember it by. Here's the sequence. First, wake up fully and turn on a light. Don't move in the dark while half asleep. Second, move from lying down to sitting on the edge of the bed. Third, place both feet flat on the floor. Fourth, and this is the key step everyone skips, stay seated for a moment, long enough to ask yourself one question. Does my head feel clear? Give your body those few seconds to catch up and adjust the pressure. Fifth, reach for something stable, the headboard, a dresser, a grab bar, and stand up slowly. Sixth, pause one more time before you start walking. The phrase to remember is this: lie, sit, feet, pause, stand. 5 words: lie, sit, feet, pause, stand. Say it to yourself tonight. And if dizziness does start while you're rising, do not try to push through it and power your way to the bathroom. Sit back down or lie back down. Let it pass. The bathroom can wait 15 seconds. Your hip cannot afford a fall. I won't promise you that this sequence removes the risk completely, because nothing does. But rising in stages gives your body the time it needs, and that time is often the difference between a steady walk and a hard landing. While we're on prevention, let's make the room itself safer, because the safe standing sequence works best in a safe environment. Keep the path from your bed to the bathroom lit. Even a small nightlight changes everything. Get rid of loose rugs and electrical cords that can catch a foot. Keep a sturdy support along the way, something solid to grab. Wear secure footwear or go barefoot, but please, not slippery socks on a smooth floor. And keep your glasses and your cane or walker within arm's reach of the bed, not across the room where they do you no good at 2 in the morning. Let me pause here for a moment. If this is making sense to you, if it's the kind of explanation you wish someone had given you sooner, do me a small favor and leave a comment below. Just say hello or tell me whether anyone ever explained this to you, and tap the like button, because it genuinely helps this video reach other men and families who need to hear it. That's it. Now, let's keep going, because the next part is about a mistake that's easy to make. That mistake involves all the other pills in the cabinet, because here's something that catches a lot of people off guard. Most of us don't think of our medications as a team. We think of them one at a time. This pill is for my prostate. This one's for my blood pressure. This little one is for my heart. We file them in separate drawers in our minds. But your body doesn't keep them in separate drawers. It experiences all of them at once, in the same bloodstream, at the same time. and several of those pills may be quietly pulling on the same rope. The blood pressure rope, Tamsulosin, can add to or interact with the effects of a number of other things. Other alpha blockers, which work in a similar way. Some medications used to treat high blood pressure, medicines for erectile dysfunction, including sildenafil and tadalafil, which can themselves lower blood pressure, and certain medications that change how your body processes Tamsulosin, which can make more of it active in your system than expected. Now, I am not telling you that these combinations are forbidden. Many men safely take several of these together, under a doctor's eye. The danger isn't the combination itself. The danger is when nobody knows the full list. So here is the single most important thing you can do. Give your doctor and your pharmacist a complete list. Every prescription, every over-the-counter product, every vitamin, every supplement, the fish oil, the herbal thing your brother-in-law recommended, all of it. Because they can only protect you from the picture they can actually see. And this is where I have to gently raise something a little uncomfortable because it matters. Picture a man who goes to his urologist and dutifully mentions his prostate medication. Good, but he got an erectile dysfunction prescription from a different doctor, maybe an online service, maybe a clinic he'd rather not talk about, and he feels embarrassed, so he just doesn't mention it. He keeps that one to himself. I understand the embarrassment completely, but please hear me. When you leave a medication off the list, you're not just keeping a secret. You're taking away your doctor's ability to see the whole picture. And in this particular case, that hidden pill and the prostate pill can both lower blood pressure at the same time. The doctor can't warn you about a combination they don't know exists. There is no shame in your medical office. There are just facts your clinician needs. Tell them everything. Now, let me address a very common piece of homemade wisdom. A lot of men, once they feel that dizziness, decide on their own to just take the Flomax at bedtime instead. The logic seems sound. If I'm asleep when it's working, I won't feel dizzy, right? I understand the thinking, but it doesn't quite work that way. Changing the clock time you swallow the capsule doesn't simply switch off the effect at the moment you stand up. The medication is still in your system, and shifting when you take it can change how it affects you in ways you might not predict. The standard guidance for Tamsulosin capsules is usually to take it once a day, about 30 minutes after the same meal each day. That timing, the same meal each day, isn't random. Taking it consistently with food can affect how steadily and predictably the medication is absorbed into your body. So please, do not move your dose from morning to night or from night to morning on your own. If you think the timing is causing trouble, that is a perfect thing to bring to your prescriber or pharmacist. Let them make that call with you. The exact schedule should always follow your own prescription and the instructions that came with your product. Now, all of this raises a fair question. When is dizziness just dizziness, and when is it something you actually need to act on? Let me give you a simple ladder with 3 steps so you always know where you stand. Level 1. Notice and document. This is a brief episode that goes away once you sit down. You stood, the room shifted, you sat, it passed. At this level, your job is to become a quiet detective. Make a note. When did it happen? What time had you taken your medication? Did anything change recently? A new pill? A higher dose? A missed few days? You're not panicking. You're gathering information that will be gold when you talk to your doctor. Level 2. Contact your prescriber. This is when the pattern gets louder. The dizziness is happening repeatedly. You're getting near-fainting feelings, that almost going out sensation. The symptoms are starting to interfere with normal things, like walking safely or stepping into the shower. Or a new episode shows up right after a dose change or a medication restart. Or you check your blood pressure and the numbers look unusually low for you. I'm not going to give you a single magic number because what's low for one person is normal for another. But you know your own baseline. If something looks off, or if blood pressure or medication was recently added, that's your cue to make the call. Don't wait for a fall to give you permission. Level 3. Seek urgent help. This is the emergency tier, and I want to be calm but absolutely clear about it. Get urgent help if you actually faint and lose consciousness, if you have a fall with a possible head injury, if you have severe symptoms that don't improve even after lying down, if you have difficulty breathing, if you notice swelling of the face, lips, tongue, or throat, which can signal a serious allergic reaction. If you have a painful erection that lasts for hours, which is a genuine emergency and needs immediate care, And of course, if someone collapses and cannot be woken up, none of these are wait-and-see situations. These are call-for-help situations. That latter, notice, contact, urgent, can take a lot of the fear out of this, because most of what you'll experience, if anything, lives down on level 1. The point isn't to scare you up the ladder. It's to help you know which rung you're actually on. Now let me bring up something men often don't want to talk about, but should. Tamsulosin can change ejaculation. Some men notice less semen, or trouble ejaculating, or what's sometimes called abnormal ejaculation, where the fluid goes the wrong direction, back toward the bladder, instead of out. I know that's not dinner table conversation. It can feel embarrassing, even a little alarming, if no one warned you. But it's a known, recognized effect of this medication, and it is completely relevant medical information. A couple of honest points about that. I am not saying every change in your body down there is caused by this pill, because aging, other conditions, and other medications all play a role too. But if you notice a persistent or troubling change, please mention it to your clinician instead of quietly stopping the medication on your own. There may be options. And here's the crucial distinction I need you to hold on to. A change in ejaculation is one thing. A painful erection that lasts for hours is something entirely different, and that one is an emergency. Don't blur those two together. One is a conversation for your next appointment. The other is a trip to get help right now. There's one more thing, and it's easy to forget, but it can genuinely matter. If you take Tamsulosin now, or if you took it months or even years ago and stopped, your eye surgeon needs to know before any cataract or glaucoma surgery. Here's why. This medication can affect the iris, the colored part of your eye, in a way that surgeons call intraoperative floppy iris syndrome. In plain language, the iris can become loose and floppy during the operation, which makes the surgeon's job harder if they're caught by surprise. But here's the good news. If they know in advance, they can plan for it and adjust their technique. So the message is simple. Your eye surgeon needs to know, even if you stopped Flomax a long time ago. And please don't stop the medication before surgery on your own. Only the surgical and prescribing teams should make that decision together. So, where does all of this leave you? Let me hand you something practical to take into your next appointment. 5 questions. Write them down or just save this video. Question 1. Could Flomax be contributing to my dizziness when I stand? Question 2. Should my blood pressure be checked lying down, sitting, and standing to see if it drops? Question 3. Could any of my other medications be adding to this effect? Question 4. What should I do if I miss several days of my Tamsulosin? And question 5. Is my current dose and schedule still right for me? Bring a complete medication list with you and bring that little symptom record you've been keeping. Those 2 pieces of paper can make a 15-minute appointment 10 times more useful. Let me ask you the second question I promised at the start. Did anyone actually explain this risk to you when Flomax was first prescribed? Be honest, for so many men, the answer is no. The pill was handed over and the rest was left to chance. If that was your experience, you're far from alone. So let me close with what I most want you to walk away believing. The goal of treating your prostate was never just to improve a number or to make a better-looking stream on some chart. The real goal is to help you sleep through the night, move through your day, and live more comfortably, without quietly trading one problem for the risk of a dangerous fall. Those 2 things have to be balanced together. And if you take one feeling away from this video, let it be this. Dizziness is not weakness. It is not carelessness. It is not just getting old and there's nothing to be done. Dizziness is information. It's your body telling you something worth listening to. So listen, write it down, and bring it to someone who can help. Please, do not abruptly stop your medication. Do not double up on a missed dose. Do not change your dose or restart after a long break without professional guidance. Those decisions belong to you and your healthcare team made together. Let me leave you with the simple recap. Know why the dizziness happens. It's the standing, not the bed. Rise in stages. Lie, sit, feet, pause, stand. Review your medication combinations, every pill, out loud. With your doctor, report repeated episodes instead of hiding them. And know which warning signs mean it's time to get urgent help. If this video helped you, please leave a comment and let me know. It truly means a lot. And tap that like button so it can reach another man or another family who needs it tonight. Most of all, share it with a man who takes Tamsulosin or with the wife, son, or daughter who helps manage his medicine. This is exactly the kind of thing that's easier to handle when someone you love understands it too. And if you'd like to keep going, take a look at the video showing up on your screen right now. I picked it because I think it'll help you next. I'll see you there.